Everyone, this is Ashley Sellers, speech language pathologist and owner and operator of Speech Language and Beyond. I am finally back to follow up with you all about the most commonly misarticulated sounds that children that have a speech sound disorder or an articulation disorder sounds that they commonly say incorrectly. And this week, we're going to discuss R and L. I'm going to do the best that I can to keep this video as short as possible because I've already in a previous video given you all the in-depth information that you need to know about articulation and everything that it is. So when we get to some sections such as place and manner of articulation, if those are terms that you do not understand, you will be able to find a description of that video or a link to that video within this video. So if you feel the need to stop and go back and review that, I ask that you take advantage of the opportunity to do so. Let's go ahead and dive into the meat of this. All right, so we're going to get into the place and manner of articulation for L. First, let me tell you why I paired these two sounds together. R and L, in our profession, they are described as liquid sounds. The reason being is because even though they are consonants, they are still made in the same area that vowel sounds are produced. And depending on where L or R is in a word, it can have the feel of a vowel, even though we have positioning of the articulators to cause a blockage of the airstream to still produce a consonant sound. So if there's something about that you don't understand, I stress to you to still make sure that you go back and you look at the video about all there is to know about articulation. So the place of articulation for L, as you notice, I tried to find a picture that would describe for us what that looks like. So the place of articulation is when the tongue tip is touching the alveolar ridge. So the tip of your tongue is pretty much going up behind your teeth. Okay, and once you make the L sound, then when you make the sound, then your tongue is going to drop back down in your mouth and it's going to be very flat. Okay, so the tongue tip is up behind the teeth and then it goes back down. The manner of articulation, the airstream passes over the side of the tongue and the velum or the soft palate is closed. This is what makes it feel like it could also be a vowel sound because of the air passing through the side of the tongue. And plus, the way that the tongue is made is still coming up near the palate, which is why it is called a liquid sound. And of course, with L sound, the vocal folds are vibrating. All right, so let's keep going. So now we're going to get into the place and manner of articulation for R. So remember, just like what I said with the L sound, the R sound is called a liquid sound because it does have somewhat of a vowel feel to it, because with vowel sounds, it's pretty much like an open mouth sound where there is no constriction of the airstream. So when the mouth is open and there isn't any type of articulator like the tongue or the teeth or the palate or anything that's being moved or blocking the way that the air is able to move, it's going to give you somewhat of a vowel sound. So with R, what happens is the tongue tip is raised up, but then it's also curled up towards the alveolar ridge, but it's not touching it. The tongue tip is not touching it, but it's raised up to where it creates a hump or a curl in the tongue, and the tongue itself is like in the middle of the palate, so that when you make the sound, we get into the manner of articulation, the airstream goes over the side. It goes over the sides of the tongue and the velum is closed. So as you can notice, just like with the L sound, The manner of articulation for R and L is pretty much the same. The airstream passes over the side of the tongue, which gives it that vowel feel, and the velum itself is closed, and they also are both sounds that are voiced, so the vocal folds are vibrating when you make those sounds. So let's keep going. You guys are doing a good job of listening. Now, here are some common substitutions for L. Okay, so substitution errors, all that simply means is that instead of making the L sound or the L sound, you're making another sound for it because you're having difficulty getting that tongue tip up behind your teeth. So the first one that we have here, it says the bilabial. Okay, so we learned from our first video, bilabial simply means the two lips. So what happens is people will do a W for L. So instead of saying light, they may say white. And what happens is when the W sound is done instead of the L sound, this person has completely not used their tongue at all. No tongue movement has been activated. But what they've done is they won't move their tongue, but they're bringing their lips forward in an attempt to make the L sound. So it says using the lips instead of the tongue. And that's exactly what happens. Or they may do a frontal palatal sound like Y for L. So you'll hear kids say, oh, turn on the yamp instead of the lamp. So the tongue tip is toward the front of the palate rather than the tongue tip being behind the alveolar ridge. So you get yamp instead of lamp. Or they'll do the central alveolar sound, or alveolar sound by doing an R for L. So instead of the tongue tip going up, then the tongue tip is up and curled towards the center of the palate. So you get an R for L. Or if the person just cannot find any type of way to activate any type of sound for L at all, they completely delete it. So this minus sign means that they didn't do anything. They just completely eliminate the L sound from the word altogether. So instead of saying lamp, then they're saying amp. So these are some common substitution errors. So what this means is that now we get to the point where the child's speech sounds funny or it becomes unintelligible. Once they add, let's just say a child has difficulty with K and G and R and L, if you take a sentence that contains words that have all of these sounds in them, their speech is going to sound, as we say, a complete hot mess. It's going to be hard to understand what they're saying, okay? Here are some common substitutions for R. And as you will look and see, it's almost the same thing because like I told you, these sounds are liquid sounds where their manner of articulation is pretty much the same, where some part of the tongue is curled up or the tip is going up and the air is going over the sides and there's vibrating. So again, instead of saying the word red, then they may say wed because they're using their lips, bilabial, they're using their lips instead of their tongue to get an R sound. You can still do the frontal palatal sound where they're still doing, instead of saying red, they're saying yed. Like almost like a Y sound, yed. So the tongue tip is toward the front of the palate versus the tongue being curled up in the center of the alveolar ridge, but not touching it with the air going over the sides. Or like before with the L, where they were doing the central alveolar, now for R, instead of doing R, they're doing an L where the tip of the tongue is behind the alveolar ridge rather than it's being curled towards the front of the alveolar ridge, towards the center of the alveolar ridge. So they're going to do an L for R. So you'll get lead instead of red. And then again, just like with L, if a child cannot find any way at all to try and get out that R sound, then they are totally just eliminating the sound altogether in a word that it should be in. So you get ed instead of red. And again, I say, if your child is having difficulty with L and R, and let's go ahead and just add on, just for the sake of an example, K and G. If you put all those sounds together in one sentence within that contains different words that have these sounds in them, their speech is going to be very hard to understand. Okay? So let's keep. Now, here are some techniques for correct sound production of L. And like I said before, I want you to be able to find these resources so you can use them at home. So I will have them, a link for them in the description box for you to be able to find. So one of the techniques that I found is called Lama therapy, and it sounds really funny. Or it may sound strange, but this is another technique that I learned from Carolyn Bowen of, I think her website is speechlanguagetherapy.com or something like that. But this was like a lifesaver for me with L, because L and R are really some of your hardest sounds for children to be able to say. I am a witness that I have still worked with children that are 9 to 10 years old, can say every other sound, and they still can't say L and R. I know of an individual, and I'm not even going to say where I know them from, because if someone knows me, they're looking at this video, they're going to promise I'm talking about this person. But it's of age and over the age of 18, and they're still having difficulty making their R and their L sounds. And it's crazy because it's like I can detect it even when like someone like my husband who's not trained to hear it can hear it. And he's like, I don't hear that. And I'm like, yes, they're doing a W for L. They're doing a W for R. Like, and it drives me crazy. So anyway, this technique is called Lama therapy. So what happens is they're using the word la and the word llama before saying words that start with L to activate the lifting of the tongue tip behind the teeth. And then as the child continues to be familiar with saying la or saying llama, over time, you're going to fade out putting la or the word llama before the word so that they are able to produce the initial L in the initial position within words. So for example, and I know this is kind of small, at least from where I'm looking, it looks small. So here's the first one. It says la, la. So you're going to have the child look at your mouth and say la, la. They go to the next one. They say llama, llama. Then they go from there to la, la, laughing, laughing. All right, and then the next stage for that one is that you're going to break down from saying la, la to just la, llama, and then la plus a word that starts with L. So you have la, llama, la, large. So as you notice, most of the words kind of have the la sound at the beginning because that's what we're going for. And then once they are done and we feel that, okay, they're making progress, we're going to eliminate the la and we're just going to go llama, llama, large, large. Okay, so eventually you will want the child to be able to say laughing, large, without the word llama or without the word la. Now, you may say, this doesn't make any sense to me. Why would I try to teach them the word la when they're still doing a W for L? You wouldn't, okay? You have to, if they cannot make the L sound in isolation, and that simply means before you pair it with another sound, that is where you need to start. The child needs to be able to make the L sound, in my opinion, at least 80% of the time in isolation and in initial syllables like the word la, before they start trying to practice it in words like llama, laughing, or large. You have to work your way up to this. So this would typically be for a parent where, okay, the child can say la or make an L sound 50 to 80% of the time. So now I feel comfortable where even though they're still kind of doing a W for L in words, being that they can say it by itself or they can say it in a simple syllable 50 to 80% of the time, then now I can go ahead and start trying to introduce that L sound in words to get them used to being able to say it. Now, I personally say I want 80%, but you can start with trying to introduce it to them at 50% because it can help. But if it's not at least at 50%, I wouldn't even attempt to try to do any words until they can do this. La, 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 or la, 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 li, lo, that they can say it in different simple syllables. And once they're able to do that, then you can introduce it in words. So I hope that makes sense. Let's go on to and I think this time I pretty much only did maybe one technique for each sound just because I'm giving you ones that I have used before. And I don't expect you as a parent to be able to go in and just do the drill work the way we would, but just to kind of give you somewhere to start that is not too complicated for you or for the child for you to be able to do it. So the next one, also a trick that I learned from Carolyn Bowen. It is called the treasure trick because the the TR sound or the TR cluster is an easy transition, makes for kids to have an easy transition into the production of a consonant R. And I say consonant R because we do have vocalic R's like car or store, but we're only focusing at this moment on the consonant R, like what we hear in the word red. Okay? And so what they say is you introduce the child to words like triangle, track, tree, train, which is kind of what we see in this first picture here. You just get them to get used to making the tr sound because that sound, and I don't really understand why they call it TR because phonetically, the TR to me sounds like almost a CH and an R together. You don't really get a true T sound in the tr to me, but by saying tr, that ch sound in the beginning of it makes it easier for the child to curl that tongue to get R. So they're telling you to start with words like triangle, track, tree, or train to teach a child the R sound. And once they are used to the tr sound, then you come here and you treat it like a minimal pair. And what that means is that, like I showed you when we were working on K and G, where a child would typically do like a T sound for a D sound. You're going to pair the error sound with the target sound together so they can get used to, going from one place of articulation to the next without any type of error. So you go from saying TR words only to saying track, rack. The only difference between those two is that we don't have that T sound at the beginning because you're getting to the point that you want to fade the the ch part of the tr. You want to fade it out so we can start to focus on the R sound. So you would say track, rack, trace, race, tree, even though that's not necessarily a real word, but that's what you want them to go to. You want to get them used to saying the TR and then taking the T out. Saying the TR, then taking the T out to get the R. And once we feel comfortable enough with them making the R by itself, you totally eliminate the TR sound to get them to the point that now they could just make the R sound by itself. Race, rack, red, read, without any other words that have the TR sound in them. Now, like I said, I would not try to introduce the R sound in this manner until in some way, shape, form, or fashion, they are making the R sound at least 50 to 80% of the time, or they do a very close approximation of the R sound that could lead into a more stable production. So this was just another tip and strategy that I feel like you all. Oh, I didn't think that I had, but I did include another tip for trying to create the R sound. And this is called the Carla Method. I found this on speakingofaspeech.com. I'm not quite sure who came up with it, but you're using the name of the word Carla to produce a correct R sound. So what they're doing is using the K sound and the L sound to lead into the production of the R sound within the word Carla. And this kind of does operate in that area of a vocalic R, but you're still getting an R. So you're starting with the back of the tongue with k, 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 k. You get the child to do that a few times first, like they're kind of telling us here. You open your mouth and get the child to say k, 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 k. Then you put your tongue tip behind your teeth and you slide it back along the roof of your mouth. So it's like, to get the child to say la, 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 la. So they're going from this k, 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 la, 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 k, 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 la, 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 la. So when I take that pause, after I get out of k, I'm literally taking the tip of my tongue and sliding it back into L. Then eventually, you get the child to combine both of those together. Kala, 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 kala. And eventually, they're going to go faster. Kala, 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 kala. So the repetition and them speeding up the pace of it naturally leads into that R sound. So you go from kala, kala, kala to kala, 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 kala. Because going from that K sound, sliding your tongue back into the L sound creates that hump for R. Carla. Because you know K is made this way, L is made this way. If you combine this and that, and this is going to eventually still give you that R sound. Kala, 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 kala. That's pretty much what it's supposed to look like. And you keep getting the child to repeat that sound until they get comfortable with the production of R. So I don't really know how you guys feel about these methods, but these are really methods that we use to get your child to speak correctly. So the next time you want to feel like you don't really appreciate what your speech therapist does, these are some of the silly things that we have to do. And it may appear silly to you, but it's based off what we have learned about the function of the articulators, how all those things are coordinated together to get us to produce sounds correctly. These are methods that we use to try to train that part of the brain, the motor part of the brain that controls speaking, in order for it to, it's kind of like when I make the decision to move my hand like this. I just made the decision without thinking about it. That's what we want your child's brain to do when it comes to sounds that they're saying incorrectly. That when your child makes a decision to say a K sound, because we have trained them with these methods over and over and over and over, then all of a sudden their brain begins to pop off very quickly. Like, okay, we can do this now. K, 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 g, 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 r, r, r. La, 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 because we're giving them techniques that have trained their brain on when to make sure that motor thing starts whenever it's supposed to. So it's like when they first come to us, and it's not a part of their brain that they necessarily control. Either they get it or they don't get it. It's motor planning that they don't know that they have to do. It's something that should come to you automatically because the brain is, the synapses of the brain is firing off the way that it's supposed to initially. But if it's not, it's kind of like your child is kind of coming in with the brain kind of saying, okay, I want to make R, but I can't right now. So all I know how to help you do is just say wah, wah, wah. But then when I give them the strategies, okay, I can do wah and go from wah, wah, because you're giving them so much training that the brain is now knowing how to fire off fast enough to get them to produce the sound correctly. So I hope that that makes sense. And I just, right before I leave, I want to give you just a few other techniques that I feel like can help you with trying to help your child produce an L and an R sound. I call this method, this is what I call it. I don't know if anyone else does it, but it's what I've learned how to do in my experience with trying to teach children how to make the L and R sound. So you know how with one of the techniques that, one of the common substitution errors that we talked about when the child does like a W, a w for L or R, or they do the y, that comes from the fact that the child is doing too much movement of the chin. They're activating the movement of their lips a little bit too much to where it's getting in the way of how the tongue needs to move. They're not activating any type of tongue movement at all. The chin is moving too much, the mouth is moving too much. So to prevent those two things from happening, I use a technique that I call open mouth, stiff chin. So you open your mouth really wide and you tighten your chin muscle because you don't want it to move. You can literally produce these sounds with open mouth and a stiff chin, and it makes you focus on activating the movement of your tongue. So you can do L just like this with an open mouth and a stiff chin. La, 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 la. My mouth is open. My lips aren't coming forward. My chin is not moving up and down. But you'll see, you can do it like this. La, 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 la. A lot of kids do that. And because that chin is moving, because those lips are kind of coming forward, it's making them not activate the tongue. And because I want them to focus on the tongue, we're going to open wide, stiffen the chin. La, 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 la. And sometimes I have the child like put their finger or their hand under the chin so that if they feel it move, they know they need to stop and start again. That it doesn't need to move. If you put any pressure down on this finger, la, 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 you know you're not doing it right. So even if you have to hold your hand under your chin to make sure that it doesn't move, la, 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 to make sure that it doesn't move. Same thing with R. Open mouth, stiff chin, just to activate the R sound. And as they're able to get used to what the tongue feels like when it's moving, then they can go back to just making it normally without the open mouth and the stiff chin. But I do that sometimes to make them focus in on making sure that they are activating their tongue movement. And last but not least, oral motor exercises. You perform these exercises with your tongue or your lips to strengthen them for correct production of the target sound. For example, licking a lollipop for L. So you can get them to hold the lollipop in front of their mouth and just say, and just focus on getting that tongue tip up, because that's the same movement that you're going to make when you're producing the L sound in your mouth. Or you can get a tongue depressor and have them hold down the tip of their tongue. So I'm going to act like my finger, it's a tongue depressor, and to get them to curl their tongue up towards the roof of their mouth for R. R, 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 R. So they're not trying to move that tongue tip up to give them like an L sound for R. So those are different types of things that you can do. I did not intend for. I would like to thank you all so much for watching. I'm so appreciative of your support. Please share this video, subscribe to our channel, and make sure that you take advantage of the playlists that are listed here for you to go back and review previous videos. I will admit that towards the end, when I kind of went back and I reviewed the video a little bit, when we did the open mouth and the stiff chin, I try to make my chin as stiff as possible. There are times when you will get a little bit of chin movement, but we just don't want it to be over exaggerated. And I just felt the need to put that in there because you have some of those people that are just looking for that one little small thing that goes against something that you've already said to try to make an issue out of it. I offer my opinions to help. That's what I'm trying to do. And I just want to let you know again that I love you guys so much. I hope these things are working out for you. Please feel free to contact me with any questions or concerns. Thank you all so much, and I'll see you in the next video.